Uh, we all know fasting blood sugar glucose level and postprandial blood glucose level are commonly done in diabetes and other metabolic disorders. In this video, we'll see why these two tests are important in case of diabetes patients or why it is commonly done. Okay, we all know fasting blood glucose level usually measures the baseline glucose control, and this is tested after 8 to 12 hours of fasting, meaning usually early in the morning in an empty stomach. This test is done. This test reflects the liver's ability to regulate glucose level. Okay. Now, to put it in simple terms, the liver stores glycogen, right? When glucose is excess, the liver stores the glycogen. We all would have experienced early in the morning, no, when we have a breakfast, and then within about 2.5 hours, for example, around 8 o'clock you had your breakfast. By around 10 o'clock, again you are hungry because your blood glucose level is coming down, right? But in the night, you see the same situation. What happens after you're done dinner? For about 8 hours, you can sleep without disturbance to your sleep because glucose level is maintained throughout the night, right? You don't feel hungry within about 2 hours of sleeping. Now the question is how this works. Okay, that is controlled by your liver. Okay, once you in the night throughout the required glucose is released by the liver by glycogenolysis and glucogenesis overnight. So you can understand when we are testing the fasting blood sugar level in the morning, it indirectly reflects how well your liver was releasing the glucose and how well your cells were utilizing this glucose throughout the night. Now the same when we apply to this postprandial blood glucose level, it is usually tested 2 hours after a meal. Like morning, a patient comes with an empty stomach, and you do the fast. You take a blood sample to estimate fasting blood glucose level. Then the patient will go have breakfast. From the time of taking the breakfast, he'll note down. At 2 hours, he'll again come back and give the blood sample. Now, this effectively actually assesses how well the pancreas releases the insulin and how it helps in glucose uptake. Okay, because see now, once the person has taken breakfast, the blood glucose has increased. Okay, usually it can go as high as 160, 180 or 200 also it will go. What happens is now, because of increased blood sugar level in the blood, now your pancreas will beta cells will detect there is very high glucose level, so it starts releasing insulin, and that insulin will act on different cells in the body and it will help in glucose uptake into the cell, so the blood sugar slowly reduces. So just to put in simple terms, fasting blood sugar level tests the liver's ability to regulate glucose homeostasis. Postprandial blood sugar usually assesses the pancreas capacity to secrete insulin and insulin resistance. But remember, it is not entirely black and white as I mentioned, because both liver and pancreas